Hi, my name is Reagan Weaver, and we are Team A. We will be discussing Chapter 19, Pharmacoeconomics. I'll be reading the case scenario. Psoriasis is a common chronic inflammatory skin disease with a prevalence of about 2 to 3% in the general population. It typically presents as a thickened, scaling plaques, which are often pruritic. Psoriasis has been associated with markedly elevated healthcare utilization, work limitations, and productivity loss. This, along with the clinically relevant reductions for health-related quality of life experienced by many psoriasis patients, underscores the need for effective management with one of a number of potential drug therapies. While mild or localized disease may be managed effectively with topical agents, patients with moderate to severe disease often require systemic treatment. In the United States, there are two broad classes of systemic drugs that treat chronic plaque psoriasis: non-biologic agents and biologic agents. A non-biologic systemic agent, such as methotrexate, is often effective but may be associated with significant long-term toxicity. Furthermore, some patients have disease resistant to such agents or become refractory to treatment. As a result, patients often report high levels of dissatisfaction with such drugs. Numerous biologic agents have also gained United States Food and Drug approval for psoriasis treatment. These agents, however, are associated with toxicities of their own, including an increased risk of significant infection. Biologic agents also have an annual cost that far exceeds that of non-biological agents such as methotrexate: $18,000 to $28,000 for biologics and $1,200 for methotrexate. A well-done randomized controlled trial is published in a respectable medical journal that demonstrates for the first time that a biologic agent, adalimumab, is more effective than methotrexate for treatment of moderate to severe chronic plaque psoriasis. Specifically, a greater proportion of patients taking adalimumab achieved in the trial's primary efficacy endpoint, a 75% reduction in psoriasis area and severity index score, compared to those receiving methotrexate. This trial further demonstrates that patients receiving adalimumab have a better health-related quality of life, but also a greater theoretical risk of severe infections. As a result of these new findings, Bob, the chairman of a large managed care organization, Husky Health, Pharmacy and Therapeutics Committee, is asked to consider the economic impact of adding biologic agents, such as adalimumab, to the formulary for this purpose. He needs to conduct a pharmacoeconomic evaluation to aid him in his decision-making process.
Hello, my name is Falake Olalea, and I will be speaking on the perspective. In Chapter 19, Pharmacoeconomics, the case scenario depicted a situation in which studies were conducted in order to determine the efficacy and benefit of non-biologic agents versus biologic agents. In a randomized controlled trial, results showed that the biologic agent, adalimumab, was more effective than the non-biologic agent, methotrexate. As a result, the chairman of a large managed care organization's pharmacy and therapeutics committee was asked to conduct a study on the impact of biologic agents to the formulary. In such a study, it would be deemed essential to determine and identify the perspective in which the study would be conducted for the pharmacoeconomic evaluation. While pharmacoeconomic evaluations can be conducted through various perspectives, such as the patient, the employer, and so forth, in this particular case scenario, the perspective would be from either Husky Health as an entity or the managed care organization's major employer group. Other important factors in identifying the perspective of this pharmacoeconomic evaluation could be, but are not limited to, considering relevant cost. In this case scenario, relevant cost could be money allocated towards the production of biologic agents versus non-biologic agents, how costs are valued. For this case, costs could be valued based on the number of visits and satisfactory of visits for patients with psoriasis. The choice of measured outcomes. In this case, the choice of measured outcomes could be the number of times non-biologic agents are prescribed in comparison to biologic agents. And lastly, the time period in which the product or service will be evaluated. In this case, the time period could be anywhere between 6 months to more than a year.
Hi, my name is Gabe Mellenbecker, and I will be discussing the identification of relevant costs and relating it to the addition of adalimumab, brand name Humira, to the Husky Health formulary. The method to broadly identifying relevant costs is done by evaluating whether or not these costs would have been extant regardless of the existence of the specific program, in this case Humira. These costs are frequently divided into these categories: direct medical, direct non-medical, indirect, and intangible costs. Direct medical costs include anything that affects what is paid towards healthcare. It includes doctor visits, lab work, prescriptions, amongst other things. This would have to be evaluated for our case because although the prescription cost for Humira is much higher than methotrexate, the patient will be less likely to incur costs from doctor visits and other treatments. Direct non-medical costs are things such as transportation of patients to medical sites and housing when attending medical sites. Although this is a very important factor, it plays a very small role in our case. Indirect costs are costs that are the result of medical issues but are not medical in nature. For example, a person suffering from a long-term illness may not be able to work, costing them a chance at income. This removes disposable income from the economy. Intangible costs are not directly monetary costs. Rather, they are costs that are related to pain and discomfort of the patient. While these costs are difficult to analyze in a meaningful way, they are very present in the forefront of the patient's mind and must be accounted for in some way. As Humira is a more effective controller of psoriasis, it would be very valuable to the patient to reduce their pain and minimize the impact of the disease on their lives.
Hi, my name is Molly Lacey, and I'll be talking about alternative interventions. When picking the appropriate medication for treating any type of illness or symptom, there are usually many options that will work. In the case of treating psoriasis, it's important to analyze options by identifying alternative interventions by using an incremental cost effectiveness plane. This plane lays out 4 different options looking at different medications consisting of drug A and B. In Quadrant 1, it's more costly, more effective. Quadrant 2, more costly, less effective. Quadrant 3, less costly, less effective. And Quadrant 4 is less costly, more effective. If the options fall in the quadrants of 1 and 3, then the options will be analyzed. If the option falls in Quadrant 2, then it will always not be considered. And if the option falls in Quadrant 4, it will always be considered the best option. For the quadrants that need to be further analyzed, pharmacoeconomics must be visited. In this particular case, drug A would be the biological agents, and drug B would be the newer non-biological agents, including methotrexate. The non-biological agents, such as methotrexate, have been reported to have a dissatisfaction rate due to toxicity and drug resistance. The biological agents have recently been FDA approved but have increased infection rate, and they also cost significantly more by up to $26,800. This particular case falls in Quadrant 1 because the biological agent costs more but will deliver better results, so it will be further analyzed. The question that must be asked is if the extra cost is worth obtaining the desired outcomes. Observing the treatment outcomes can be difficult, for it can take years to decades. Reduction of psoriasis symptoms, including pain in the joints as well as skin conditions such as dryness or rashes, are observed using both medications.
Hi, my name is Kendall Schmilke, and I'll be talking about sensitivity analysis. Patients with moderate to severe plaque psoriasis usually need a systematic treatment with biologic or non-biologic agents. The doctor determines which agents are used by performing a sensitivity analysis. This analysis tests key outcomes and the cost of the treatments to determine how sensitive the results are to variation. There are 2 types of tests that can be performed. The first is a one-way simple sensitivity analysis. This test looks at the variation of cost or key outcomes to determine if the original results are correct. The second is called a multiple-way simple sensitivity analysis. This test is conducted the same way as the one-way sensitivity analysis test. In the case study, the chairman of Husky Health must determine if the hospital will add biologic agents to the formulary or not. The results of the multiple-way sensitivity analysis would have to conclude the biological drugs are as high of value as the non-biologics and are as cost-effective as the non-biologics.
Hello, my name is Jim Summers, and I'm going to discuss cost minimization analyses. Cost minimization or cost identification is an analytical process used in pharmacoeconomics to examine the cost of drug treatment when the clinical effectiveness of the alternative therapies is identical. The main purpose of the CMA is to choose the least costly alternative among interventions with equivalent outcomes. The requirement of equivalent outcomes limits the application of CMA to those situations where equivalency of both effectiveness and safety consequences has been established. Comparisons between branded and generic products, comparisons of different routes of administration of the same drug, and comparisons of different settings for the administration of the same drug therapy will be made. A perfect example is inpatient versus home therapy treatments. There are 2 types of CMA levels, micro and macro. At the macro level, analysts examine not only the clinical effectiveness of medication, but also the impact of that drug in the long term to the main factors while determining the expenditure size of health budget, such as structure of types of disease in society, the income status of the technical and quality of the health systems. Also, the impact of drug groups to these factors must also be equivalent to compare the related drug price subsidies or tax benefits connection with the research and development activities. Because the consequences of alternatives being compared are shown to be equivalent, CMA focuses on cost differences. These differences in cost can be presented an average cost per patient or average total cost of care if the number of patients in the same under each alternative. When choosing between alternatives, decision makers will then choose the alternatives with the lowest total cost. This concludes our presentation today, and Team A thanks you for watching our presentation on pharmacoeconomic methodologies. Thank you.